If you are on a diuretic for hypertension like hydrochlorothiazide or chlorthalidone, this summer's heat could land you in the emergency room. But most patients are never told why. I'm Dr. Courtney Washington. Here's what you need to know. In 2025, the American Heart Association and the American College of Cardiology reached the first major update to blood pressure guidelines since 2017. Most patients have not heard of what changed, including why this summer's heat carries more risk than it used to. The number you need to know. First, the number. High blood pressure now officially starts at 130/80, not 140/90, which is the figure many people still associate with the diagnosis. If your reading falls in the 130s, that is not a number to dismiss. It's the threshold your physician is now watching. Why two patients with the same reading get different treatment? Here's something that surprises a lot of patients. Two people can have identical blood pressure readings and receive two different treatment plans. The reason is that physicians now calculate a risk score that accounts for your overall health picture, not just one number, to estimate your real risk of a heart problem in the next decade. If that score is high, medication starts immediately. If it's lower, you may be given several months to lower your numbers through diet and exercise before medication is added. Same reading, two different paths. And that reflects more precise medicine, not inconsistent care. Why treatment starts faster for higher readings? For patients with higher readings, 140/90 or above, physicians are now more likely to start two medications combined into a single pill from the onset, rather than adding medications one at a time over several months. This approach controls blood pressure faster and is easier for patients to maintain consistently. A question most patients never ask. Here's a statistic worth knowing. Among patients on 3 or more blood pressure medications who are still not controlled, more than half may have an undiagnosed hormonal cause, something that can be identified with a simple blood test, and it's often treatable. For years, physicians only tested for this when potassium levels were low. Current guidelines recommend testing regardless of the potassium level. If this applies to you, the question to bring to your next appointment is a straightforward ask. Ask whether hormonal testing is appropriate for your blood pressure. The heat and diuretic risk. This is why I built this episode around summer. Heat causes your body to lose fluid through sweat. A diuretic causes your kidneys to remove additional fluid on top of that. Together, this combination increases the risk of dehydration, dangerously low blood pressure, dizziness, and kidney stress. I want to be direct about this one point. If you feel dizzy or lightheaded in the heat, do not stop all of your blood pressure medications on your own. That can be equally dangerous. Call your physician. The appropriate adjustment is often to the diuretic specifically, not to the medication protecting your heart. Watch for dark urine, dizziness when standing, and unusual fatigue. These are early signs. Confusion, a rapid heartbeat, or hot, dry skin are medical emergencies and require immediate care. Your summer checklist. To summarize what to do, know your number. Ask your physician about your personal risk score if your reading is borderline. Ask about hormonal testing if 3 or more medications are not achieving blood pressure control. And never adjust your diuretic without speaking to your physician first. The condition has not changed. The guidance managing it has become more precise, and that precision can prevent an unnecessary emergency room visit this summer. If this information was helpful to you, subscribe. I explain what's actually changing in our health and healthcare system and the latest research in plain language every week. Leave your blood pressure question in the comments below. I read all of them and address the most common ones in future episodes. I'm Dr. Courtney Washington, and remember, if you don't know, ask Dr. Co.